our Luminous Opti-Light and Opti-Lift. So I'm really excited that you guys actually made it and took time out of your day to be here with us. I'm especially honored to introduce two doctors who make all of this possible. First, we have Dr. Shireen Greenbaum. I've had the privilege of working with her for almost 5 years. And in that time, I have seen firsthand the amazing changes and advances we've made together in surgery and treatments, things that are truly worth bragging about. She was one of the very first surgeons in Broward County to perform laser-assisted cataract surgery, and that same forward-thinking drive continues today. What really stands out, though, is her loyalty to her patients and her commitment to always giving them the very best care. Alongside here is Dr. Amberg, who has been recognized as one of America's best eye doctors, ranking in the top 200 across the country. Her expertise and attention to detail and the way that she connects with patients has made her such an important leader in the field and an incredible part of this launch. Together, Dr. Greenbaum and Dr. Amberg represent what tonight is all about: combining innovation with compassion to bring real relief and better care to those suffering from dry eye. So please join me in welcoming Dr. Shireen Greenbaum and Dr. Amberg.
Thank you guys so much for coming. I really appreciate it. Hopefully everybody enjoys food, drinks, and just a tour of the office, meet the staff. A lot of you have been here before and you know us already. But I think tonight is about learning about some new things that we're doing here, some rollouts, some very interesting things. And I just wanted to give a little bit of a background on what we're doing and why we're doing it. Dry eye is probably the most underdiagnosed condition of the eyes that we see. And I realized a long time ago that I can do a beautiful cataract surgery and somebody can be unhappy with their vision, and it has nothing to do with me or the lens implant, but it's about the dryness of their eye. And we also noticed that a lot of practices do not take the time to treat dry eye and to really look for underlying causes, look for ways to prevent it, understand preventative medicine, systemic disease, and how that contributes to dryness. And we really want to be the premium practice in Broward County for dryness, because this is something that I suffer from, my family members suffer from, many people, whether you've had refractive surgery in the past, whether you have autoimmune disease, whether you're on glaucoma medications, dryness can come from many different causes. And we get a little tired of just, here's a medication and see you in a year. We know that doesn't work for most people, and so we need to look for other ways to treat this debilitating condition, because it really is. For those of you who suffer from dry eye, you understand. The second thing that I wanted to talk about is just how our practice is different from others. You may have noticed in South Florida that a lot of medical practices have become corporate. The reason for that is that they're being bought out by companies. They're run by people who are not doctors, who don't know how to treat people, never learned empathy. And they're really just all about the bottom line. And we really do not ever want to be a practice like that. We want to take our time with people. We really want to treat everybody as if they're our family. And every time I see a patient, that's in my mind. This could be my sister, my brother, my father. And so we really want to maintain that type of care here at the practice. The membership will also come with a lot of discounts on premium services. As you all know, and we know as a community, a lot of things that we want in medicine, a lot of treatments may not be covered by insurance, unfortunately. And those things can get costly for people. They might be worth it, but it may be difficult to manage that. And so our members will have an opportunity to get discounts on all of those services that we offer. So just be looking on our website. You'll understand more about the membership plan. And last but not least, as you know, I'm very into aesthetics. And I think that one thing that ages people, as we age, is the area around the eyes. Our face and our skin can look great, but if the area around our eyes, if we have bags and wrinkles and sagging and lowered brow, it's going to age us. And people care about that. They not only care about how they see, but they care about how they look. Now with things on Zoom and everything over the computer, people look at us. and they judge us. Let's be real. So we really want to focus on aesthetics, but specifically the non-surgical aesthetics. We don't want the pulled, tight look of somebody who's had multiple facial surgeries. We want a non-surgical approach to improving aesthetics of the eye and of the face. And so I'm very pleased to basically introduce you to Dr. Amberg. I specifically chose Dr. Amberg after going through and having a lot of different providers here. Dr. Amberg has an extensive training in specialty contact lenses for dry eye, as well as corneal disease and treating the anterior surface of the eye. I don't think I've ever met a smarter doctor, and I'm so happy to have her here with us. It's amazing. Sometimes she can talk very, very fast, and so I've asked her to slow down a little bit tonight and discuss some of these things in more detail for the next few minutes. So I'm going to turn it over to Dr. A.
Thank you, I appreciate that, Dr. Greenbaum. I wanted to take the time to thank all of you for being here as I'm looking at all of you guys. You guys are my patients. I see you all the time. I know everything that's going on with your eyes. I've looked at you in my chair, and it really means a lot to me that you guys came out, and to all of us here. And I really want to go through and tell you guys about some of the treatments and how they're going to help you guys and help with dry eye aesthetics. As Dr. Greenbaum had mentioned, dry eye is a passion of mine. Dry eye is a very, very underdiagnosed, chronic, and progressive eye disease. And the reason that it is so underdiagnosed is because often one of the first signs is blurry vision. And for many, many years, patients will go to the doctor and they'll say, here's a new prescription. And it kind of goes through time, here's a new prescription, I'm not really seeing any better. Let's try a new drop. It's not really doing anything for me. And what we've discovered is it's never just one thing, it is a comprehensive approach to dry eye care, looking at the patient's lifestyle, their health, any underlying conditions, things like that. And so I'm going to talk about some of the treatments we have, and that way you guys can learn a little bit about them. So one of the first things that we do is called iLux. So iLux is a treatment that uses thermal pulsation to unclog the oil glands. Probably all of you here who are my patients have heard me talk about your clogged oil glands, because I always say to these patients, if you're on my schedule, it's probably because you have dry eye. Meibomian gland dysfunction, or MGD, is one of the leading causes, if not the leading cause, of dry eye. These oil glands produce the oil that coats the ocular surface. With deficient oil glands, you cannot actually see well because you will have an unstable tear film. So it doesn't really matter how many drops you put in your eye. With an unstable tear film, you're not going to get good results with any type of drop. So we have the iLux, where we actually take thermal pulsation, put it on either side of the eyelid, and it actually heats up the oil and allows expression. We love that. That is a fantastic short-term option. For many patients, it's very necessary to do so in a way to get them optimized very quickly for cataract surgery. We know it's not going to be the long-term solution, but it can really make a difference just refreshing that tear film and helping the patients feel better. Another wonderful thing we do, and I'm sure all of you guys, or many of you here, have seen the commercials about those mites that live in the eyelashes. And then you all know that we have the testing here, so we get to show you those mites. And it's very upsetting to patients. They're saying, I have bugs in my eyes. And yes, you do have bugs in your eyes. They're parasites. There's no amount of scrubbing that you can do at home to get them off. They actually have to be removed. There's no antibiotic. So we use what's called a Blefex to actually exfoliate, and it uses a tea tree solution. And on a more permanent basis, or a more effective basis, it does help to get rid of the Demodex mites and helps with blepharitis. I just talked about those two conditions, so I'll tie it in with another condition that we know and love so well, rosacea. So rosacea is another very underdiagnosed condition of dry eye, which is an inflammation of the skin on the face and the oil glands. And the reason it's so underdiagnosed is until it really flares up with, the redness, patients aren't really aware of it. They're just saying, sometimes I get a little red when I go outside, or heat. And unfortunately, that really does, that constant and chronic inflammation
does have a permanency of hurting the oil glands and clogging them up. So we actually pair that with some of our other treatments that I'm going to get into, but I wanted to bring that up because that's going to tie us in to aesthetics and dry eye. So I want to also talk about with rosacea, dry eye, MGD, IPL. That is what we're talking about launching tonight here. Many of you have already undergone some of our IPL, radio frequency, dynamic muscle stimulation treatments, and I'm going to talk a little bit about the IPL first. So what is IPL? If you Google it, you're going to get a whole bunch of things. It can be very confusing. IPL is intense pulse light therapy. This is an indirect laser that can be used on the tissue underneath the eyes for the delicate tissue, and it can be used actually all over the face. When you use it for the meibomian glands, it actually re-stimulates the collagen, the elastin, the fibroblasts, the hyaluronic acid in a very natural and regenerative way. So we use that to restore the tear film surface on a longer term basis. The beauty of the IPL is it can be used actually anywhere from here on up. So a lot of you here as well have also had our photofacial part. And when you when you do the IPL on your face, it actually gives you a beautiful skin tightening. It reduces those red spots caused by rosacea, discoloration caused by brown spots. And it almost in a way tricks your body into reversing a little bit of that aging process. Just for reference, I have gone through all of my IPL treatments. So this is my face after IPL for I think about like 6 months now. Yeah, and I'm ready for maintenance. And so then we follow up the IPL with what is called radio frequency. So we also use the radio frequency to penetrate deeper into the tissue. You may have heard about different things like, oh, a TENS unit, oh, this or that. That's great. That doesn't really scratch the surface or do anything for dry eye or for the muscles in your face. Radio frequency, having the ability to penetrate 4 millimeters deeper into the tissue after we use IPL actually allows gland expression. So it's training your oil glands to express out much more naturally, something that we lose over time. We then follow that up with what's called dynamic muscle stimulation, which this is a very unique thing that we have to our practice. That's called the Opti Lift. So the Opti Lift targets lower lid laxity, which, as anybody knows, with sleep apnea, the natural aging process, perhaps your eyelids don't close at night as they should, a delayed blink response, someone who works on the computer all day, those type of things. The dynamic muscle stimulation really, really targets that. And it actually can put the lids into a better position. And we found great success with doing that in a non-surgical way. So those are some of our best treatments. And a lot of you guys know me, I'm very passionate. So for me, it's never just one thing. It is a treatment package, it is a plan. For some of our patients where things can be more corneal disease, we do something called autologous serum tears. That's where we take a blood draw, we put it in a centrifuge, separate out the plasma, we dilute it down with a sterile saline to make eye drops for you. And I can tell you there is nothing more biocompatible and more neutral than your own body to heal a wound, because that is what that dry eye is. They're little scratches and wounds on your cornea. So we use all of those things together and we take it as a holistic, full body approach. None of this involving toxins or chemicals or anything unnatural going into your body. And so I would say I definitely will continue to work with all of you guys. As long as you guys are our patients, I will continue to go forward and trying to find the best dry eye treatments I can find, staying up on the best innovation, which I'm very proud of here at our office with our team. We all stay up to date, we go to CE. And I want to say one thing about our machines. From the day that I got here, I said, what? We don't have IPL. What's going on? It's not just so...
I needed you. That's why.
It isn't so quick and easy as to just buy a machine, see if it works. We, Dr. Greenbaum, myself, our managers, we actually took a year to really find the right machine that would give us results. We tried it ourselves, we had our staff laser certified, so it was a very thought out and measured process to really get you guys the absolute best available technology. Because I was born and raised in Florida, and I love this community, and if I ever have an opportunity to give someone the best medical information I can, I am always going to do that. And I always want to tell you guys that we will be here for you guys to treat your dry eye, to help you with everything else. So on the medical side, we got you. I want to add in a little bit about the aesthetics, because my other passion is actually aesthetics. We're really taking off with the aesthetics. We're actually getting people coming in here just from Instagram. Oh, someone told me, I saw you on Instagram and you were talking about IPL. I want what you have. And I was like, great, let me tell you all about it. And we have found such success with treatments that really require no downtime. And I think a lot of you guys who've had them here can attest to that. You can get a beautiful glow, a tightening, a very beautiful alternative to surgery that will really rejuvenate your skin and is very much more so cost effective than surgery as a full facelift. So I can tell you guys we have all of those options here. We're going to be going into a little bit more tonight. I want to thank Dr. Greenbaum. I want to thank Roxanne, our managers here, everybody here for putting this together.
411. One syringe of filler administered by yours truly for beautification purposes. 070.
Full dry eye ultimate package, the value is $3,500.
Okay, let's see. One, and we've got 135. 135. You're welcome. Working on that, we will do the grand prize, which is a package called the Lifted Glow, worth $4,800. All right, I'm really doing this thing here. Let's see what we got. All right, 097. 097. I would like to thank all of the staff who stayed late and worked so hard. I want to say a special thank you to Carmen with our new drop that we partner with for improved reading vision. Thank you, Carmen, for being here. We look forward to working with you in your company.